So you graduated, you became an optometrist. I think you said you worked clinically for 3 years, and then you switched out. Maybe what were some of those things that you were doing as an optometrist? Some high level activities.
In clinical optometry, the work is, I think, fairly clear cut. So you work in a practice, patients book appointments, you do eye exams, and I loved that. Honestly, for the first 3 years, I did enjoy it because I enjoyed working with people, I enjoyed helping people, adding value. And so the reward of, especially I think where I got a little bit more driven towards a public health approach, the reward of people who've not had a pair of eyeglasses ever, and they've got a significant refractive error problem, and they come in and you do an eye exam and they see that you invested, you're doing a quality assessment, and they say, you know what, thank you for spending the time, you've listened to them, and then they walk out with a pair of eyeglasses and they literally see the world differently. It's the quality of life that you've added to them, and then you feel this, it's this feel good sensation that, wow, I've made someone's life better. So that was really a highlight for me, I think, working with individual people and seeing how my work was contributing to them having an improved quality of life. But I soon came to realize that that was just one on one. I was having impact on one person at a time. At most, I could maybe see 20 people in a day on a good day. When was I going to get to the other, so many more people who were not getting an eye exam? And so I started to see the bigger picture that I need to now scale my impact. Yes, I'm adding value in the practice to individuals, but how can I now scale my impact to communities who've never had this? And how can I bring that to those communities? So much as I really enjoyed my time in clinical practice, I knew that that season was over because my impact was limited. And in order to scale my impact, I needed to move to a public health space.
And in doing so,
Mhm.
you got your Masters of Public Health from the University of the Free States, and then you're talking a little bit about the conversation and then formation of this global programs officer at the International Center for Eye Care Education. So kind of maybe walk us back through that thought process of going for the degree and then getting into this program, and what some of the, well, you already explained a lot of the key things, maybe just more about the degree and that thought process more so.
Sure, thank you. So I recognized if I wanted to, because this was an emerging space, public health optometry it wasn't a thing, optometry as a profession was kind of sidelined in mainstream healthcare. And I realized that if I wanted to make an impact, and one of the avenues to be able to make an impact on a larger scale was to get a leadership position within government, within non-governmental organizations. But in order to get that, I needed to invest in myself and equip myself with the master's, which was respected. If I wanted to apply for any management position within the Department of Health, that would stand me in good stead. So that was my thinking. Let me equip myself for a management or leadership role in healthcare within the country so that at that level, I would be able to influence policy and systems change. And so I'd mentioned registering for Masters in Public Health at the Nelson Mandela School, but because I took on the role of the Project Development Officer, I moved provinces and I had to leave the Masters in Public Health because that was a contact program. Every Saturday we would have lectures and group sessions, and so I couldn't physically be present. And so when I was in the Free States, I then transitioned to a Masters in Public Administration and Management. And to a certain extent, I did that because they didn't have a master's in public health there. But also, I thought that if I don't restrict myself just to public health or optometry, I could have done a master's in optometry, but I felt it would have sort of closed me off in the discipline. And I could have a much broader reach if I just did a general master's in public management. And so, yeah, a little bit of strategy. It was just what I needed to do because they didn't have the MPH and I couldn't transfer my credits. But it equipped me with insights into, at that level, what are the things I need to know and do if I'm going to step into a leadership position. And so it was the next step up the ladder. Honestly, when I did my bachelor's, I had no intention of doing a master's. I was done. I wanted to burn my books. I didn't burn them, but I think I gave them away. But and then I realized, out of necessity, invest in myself. It would give me an advantage if I wanted to get into a leadership role and really influence at the level I thought was necessary. So that was the thinking behind that. And once again, even though I didn't know where it would, I kind of had an idea as to where I wanted to take my career. I didn't know if it would pay off, exactly what role it would lead me to, but it was another rung in the ladder of my career that, had I not done that, of course, I would not have gotten the PhD scholarship and would not have had other opportunities. So sometimes my advice to the listeners is also, sometimes you need to evaluate where you're at, what you want to do, and then seek out those opportunities, even if it's learning opportunities that you think are going to prepare you for the next stage. It may not benefit you immediately, but it's another piece in the puzzle of your career. And then when opportunity does present itself, you're already ready. You've equipped yourself. You're ready to step into those roles. And I'm not by any means saying that postgraduate degrees are necessary to have leadership or management roles in public health. But for me, certainly, it just opened the next door, which, when I moved to being a global programs officer, and I was working in international development at the time, specifically in global eye health, I was then afforded the opportunity of this PhD scholarship, which, again, I never thought I'd ever do a PhD. But the funds were there. The funder said, we want to invest in 5 PhDs that can help inform eye health on the African continent, and specifically Portuguese-speaking Africa. And they couldn't find any in Portuguese-speaking Africa. There were no optometrists at the time. So the money was there. It needed to be utilized. I was offered an opportunity for one of those 5 scholarships. If I didn't have a master's, I probably wouldn't have been able to do the PhD. So yeah, sometimes just taking those opportunities, no matter where you are in life, sets you up for the next thing, even if you don't see and know what that next thing is.
Absolutely agree with that.